When we reopen schools, we have to think about keeping kids safe on the journey to school too. And there are plenty of low-cost ways to do this, and actually ways that protect kids not just from COVID-19, but also from their biggest threat, dangerous road traffic. When we create space for physical distancing, we make it safe to walk and cycle and scoot to school. Creating space reduces congestion. And being outside and walking and cycling actually lowers air pollution, which is tied to the severity of COVID-19. Communication is important to keep our kids safe on the way to school. Reach out regularly and include people without internet access, marginalized populations, and those with disabilities. Use different modes like radio, social media, and posters so no one is left behind. In reopening plans, incorporate media campaigns about how to stay safe on the way to school. Our partner, the World Resources Institute, is doing this in Addis Ababa, Ethiopia, with the Ministry of Education. They're also building on their school traffic safety program to teach kids about how to prevent the dual risks of COVID-19 and road traffic injuries. Engaging students and asking for their opinions is critical. Students have a powerful voice, and they can be wonderful advocates for safe and healthy journeys to school. School drop-off and pickup is often a bustling scene that's foreign to the concept of physical distancing. It poses real risks for COVID-19 infection and road traffic injuries. Fortunately, there are solutions that help address not just one risk, but also the other. You can use natural, donated, or repurposed materials like spray paint, bollards, or even rocks to show students where to line up along the school building and away from a busy road. Save money by making changes through fun community activities. Install hand sanitizing stations at entrances and exits and make those one-way, and remind caregivers not to congregate. Staggering or alternating schedules also helps us physically distance and limits contact between cohorts. I know that it's not always easy to walk or cycle to school, but when you do that instead of driving, you're making it safe for everybody and you're lowering air pollution. This is so important because road traffic crashes kill our kids more than anything else, and air pollution hurts and kills them too, and has been tied to the severity of COVID-19. Walking and cycling also reduces congestion on public transport and school buses, and it helps prevent the spread of COVID-19. It helps kids spend time outdoors, and now more than ever, we all need that for our physical and our mental health. Being outside helps rebuild community and social connections and sets a new healthy habit. To make it safe to walk and cycle, you can close the street around the school just 15 to 90 minutes around school opening and dismissal. This is a great way to make sure that kids can walk and cycle to school safely. And if your school's on a busy road, maybe you can close just a lane of traffic rather than the whole street. There are plenty of ways to make it safe for our kids to get to school. Laws, policies, infrastructure, and behavior change all have a role to play. Focusing on vulnerable populations makes it safe for everybody. But the most important thing that we can do is to lower speeds to 30 kilometers an hour. It's a best practice by the World Health Organization. Lowering speeds is like a vaccine against road traffic injuries. It helps make sure that if our kids are hit by a vehicle, they have better chances of survival. When Vietnam reopened schools, they created a special back-to-school speed management initiative where they lowered speeds and reminded people of that change for the first 2 weeks, and then they enforced fines after that. Infrastructure that forces people to slow down is even more effective, like raised crosswalks, speed humps, and bollards. Cycle lanes and car-free zones also help by separating pedestrians and cyclists from traffic. Check out the IRAP Star Ratings for Schools app to identify infrastructure to make your school area safer. Make use of that infrastructure through walking and cycling school buses in which a designated adult picks up kids on a safe, predetermined route to school. And don't forget the voices of students themselves. It's empowering when a student can point to the crosswalk that they painted or the cycle lane that they designed and say, "I did that. I helped keep my peers safe." Now is a great time to teach students to be safe while they walk or cycle. We can impart lifelong skills that help us build healthy habits. Providing training, adequate space, and safety and protective equipment is so important right now. It can help kids who've been cooped up to get outside. There are plenty of ways to incentivize walking and cycling, for example, by awarding bicycle licenses or through friendly competitions for the class with the most walkers. To make bikes available in the first place, we can use community bike loans. Free bike schools can help students learn to ride, like in Bogota, Colombia. We can repurpose parking lots to encourage kids to cycle. And we can keep cyclists safe when school lets out by staggering their departures and shifts so they can physically distance, and by dividing parking areas into several smaller areas. At the bike rack, we can post signs to remind students to physically distance, wear a helmet, and sanitize their hands. Walking and cycling helps make the journey to school safer for everyone, but we know that some students have to rely on private cars. If there has to be car traffic near the school, prohibiting idling can keep the air clean. In New Zealand, kids are dropped off at a safe location a little bit of a distance away from the school, and then they can walk the rest of the way. They call these kiss and go zones. The drop-off locations can be anything from a business to a religious institution or a government building with parking lots on a walkable route. Carpooling with members of your bubble might be another option. If you have to travel with members outside of your bubble, please remember to wear a mask, open windows to ventilate, and sit as far away as you can from each other. The school bus should offer the same levels of safety, hygiene, equity, and physical distancing as the classroom. Scheduling is important. There are benefits and drawbacks to school bus schedules. For example, an alternating schedule with fewer bus runs might be more economically viable than a shift schedule with double bus runs. It also reduces contact and results in less traffic volume. We can ensure that everyone has space to physically distance through extra bus stops, arrival locations, and even extra buses if possible. We can limit exposure through shorter routes, reduce capacity, assigned seats, and a physical barrier for the driver. Maintaining a boarding pattern from the back to the front and skipping seats or rows can help too. Provide hand sanitizer and extra masks. In South Africa, ChildSafe provides an attendance register to enable contact tracing. Limit or prohibit drinking, eating, and loud talking, and open some windows to increase ventilation. Before every shift, bus drivers should self-screen for symptoms of COVID-19. And help the bus driver do their job, driving safely, by assigning an aide to enforce protocols and screen children. During the pandemic, many people feel a little bit unsure about public and shared transportation, and that's understandable, but there hasn't been a single outbreak tied to this mode of transport. Nonetheless, we still have to be careful, and there's plenty of things that we can do. Protocols should be enforced by transport operators, governments, and ministries, and communicated to all of us so we can be allies to students trying to get to school safely. One way to do this is through advertisements on public transportation. Some kids have to rely on public transport because they don't have access to a school bus, and we can help those kids by waiving or reducing public transport fees. We can also help kids stay safe by traveling during less busy times through staggered or alternating schedules. Commuting to school during non-peak but daylight hours can help reduce other threats like harassment and violence. And let's remember to ask students about the challenges they face and give some tips too. For example, students can wear a mask during the journey, avoid crowded stops by getting off a stop early, and choose the most physically distant seats and entry points. Contactless payment and minimal transfers, like between a bus and a train, can also help limit exposure. And of course, let's prevent additional strain on the healthcare system by enforcing vehicle safety standards and helmet wearing. The journey to school can make or break whether or not a child gets an education. A journey that's rife with challenges might mean that a student doesn't get to school at all. Before we go back to school, everybody can benefit from doing a test run, but some students will face more challenges than others. Ethnic minorities, indigenous populations, students with disabilities, girls, and the increasing number of students experiencing homelessness will all face serious challenges. Identifying and overcoming barriers to getting to school safely increases the chance that a child will get their education now and after the pandemic. For those with mobility challenges, we should remove obstacles, widen paths, and create pedestrian lanes. This helps all of us stay safe and physically distanced. Visual, audible, and tactile cues along the way can help students with hearing, cognitive, or mental disabilities. Making change isn't enough. Communication that allows students and families to both give and receive information about the journey can help ensure that they'll keep going to school. Right now, we have to make sure that our children can get to school safely. We have changes to make, and those changes will help keep them safe during the pandemic and after, when the epidemic on wheels will still be here. But to be effective, those changes have to be permanent. And to get there, we have to collect data that shows that road traffic injuries are going down and air quality is going up. Our website, childhealthinitiative.org, has plenty of ways to show you how to collect this data. And our guidance has lots of low-cost ideas on how to make these changes happen. We can show you how to work with the tight budgets that everybody's facing. Our partner, World Resources Institute, for example, in Addis Ababa, Ethiopia, is using a phased approach, making changes in phases, and also identifying and prioritizing high-risk areas. Now is the time to keep our kids safe and healthy on their journeys to school so that we can protect them during and after the pandemic. These changes are usually a lot harder and take a lot longer, so let's make them now. We can build back safer and better.